Hello everyone, good afternoon and welcome to the chat show session today. As you all know, at Eyedentity we are passionate about prevention as well as innovation, and we just don't believe in curing ailments. And today for the first time we have a session on skincare, that too from our specialist dermatologist panel, Dr. Ashwini Shetty. Hi Dr. Ashwini.
Hello, Dr. Jayashree.
Thanks for coming in.
My pleasure.
So, Dr. Ashwini, what is it that we are going to discuss today?
Yes, so what I was thinking of is discussing a little about hand care, during the pandemic from a dermatology point of view. Because
before I hand it over to you, it is my job, my duty to introduce you to our viewers. Dr. Ashwini Shetty, she is a consultant dermatologist practicing since the last decade, and she comes with a lot of interest in clinical dermatology, especially what is related to the skin and the mind, the skin and mind connect. She strongly believes that skin health reflects the overall health of the body, and a balanced lifestyle contributes greatly towards achieving this. So lovely to have you here, Dr. Ashwini. So now it's all yours. Please tell us, what is it that you want to talk about hand care during these times?
Yes, thank you. So what I see is, washing our hands and things like that have already, these are things we always do. But then what is it different in the current scenario? I would say one is the number of times, the frequency with which we wash our hands has dramatically increased. So we're washing our hands so often these days. And also the prolonged hours of working in our, say, kitchen, in our home spaces, whether it's the kitchen or anywhere else. We tend to wash our hands. We come in contact with water and soap so often, so much more than, say, in the past. Also, the added, the things that we use, the hand sanitizers and things like that, which we always use when we are out and about. So all these things are contributing towards, some sort of a damage. And earlier we recognized the signs of this. I think better it would be to kind of prevent it from getting really worse. So I would want to talk about this presently.
So then you termed it as hand dermatitis in medical terms. Is that right? And then now tell me that we have two things that we have been doing very regularly. We have been washing our hands, and we have also been sanitizing with alcohol-based sanitizers. So are both of these equally harmful, or is there any one thing that you think is like a little better than the other one?
No, both are equally harmful, I would say. But then, of course, the more effective way is washing our hands with soap and water. That's the more effective way. That would protect us better against the virus, say, when compared to, using a hand sanitizer. But both are equally damaging. And especially if it's done more often, more often than required.
Yes.
So that is there.
And then what about, we have so many formulations in the market. There are, Ayurvedic ones and the alcohol-based ones, the non-alcohol-based ones. Those that say comes also with moisturizers, So then when you have so many options, it is quite confusing. Would you just help us understand what kind of hand wash or what kind of hand sanitizer that we need to pick?
Right. Now, before I come to that, I would like to talk a little bit more about what causes problem. What happens? What if we use so much of soap? What if we use hand sanitizer? How is it going to be, damaging to our hands? So, like we all know, skin it protects us from the external environment. It protects us from the microbes, from the elements in the nature. And it does its job wonderfully if given the proper situation. But in the current scenario, we are kind of abusing it because we repeatedly wash our hands, we repeatedly sanitize. So normally our skin is, it has its own buffering capacity. It buffers very well. It goes back to its normal self. But when it is subjected to such stress repeatedly, that's when things get a little out of hand. So what are the common offenders here? One would be the soap. It's obvious, the soap. Soap, they are alkaline in nature, whereas our skin is acidic. So when we use a lot of soap, it tends to alkalinize our skin and thereby making it more susceptible to irritation and the other damaging elements. So the other thing would be the use of, water as such, even if it is plain water, it can dry our skin. And not to forget all the, in the soaps, I mean, there are so many other additives, there are antimicrobial agents and fragrances, dyes, all of these have an irritant potential and can cause more damage. Apart from that, of course, the sanitizers, they contain alcohol, and like you were mentioning, you call it in any name, it's still the sanitizer, it's still going to damage your skin. So that again, the alcohol dries your skin and makes it more susceptible. Apart from that, when we talk about things at home, we are doing a lot of work which involves friction. So
Right.
friction again can cause damage at a molecular level. So all these things are like a lot of stress on our hand. And if not now, maybe if we don't look at it, if we don't check it now, in the near future, it may kind of show up as some sort of an allergy or irritation.
Okay, so then what should we be looking for? Like what should we look at, and then what is it that we need to see as the early symptoms so that we report to you? So what do we do?
Right. Right. So the manifestation of these kind of reactions can vary. Now, there may be some people who may not react to such sort of an abuse, if you can call it so. And there are others, who I would say are a little atopic. They are individuals who have like a dry, sensitive skin. So they may tend to react or overreact to these kind of insults in a very severe form. So the manifestation can vary from anywhere between redness of the hands to itching, irritation, burning sensation. Sometimes it can even cause fissures, oozing in certain individuals. So the manifestation can be multiple. So it can
Fissures, you
manifest in
mean
any
the cracks that can develop?
crack.
Yeah.
Yes,
Okay. So
crack.
even the nails, is there anything that we should watch for the nails?
Definitely. Even the nails can go brittle, they can break. So that again indicates that it's been subjected to a lot of, stress in this form, water, soaps, and
Okay.
things like that.
So now, while we also maintain the hygiene of the hands, is there also a way to maintain the health and the safety of our hands? Are there any
Definitely.
measures that you would want to suggest?
Definitely. I think the first and foremost thing would be, judicious hand washing.
Mhm.
I think we should be careful about and be mindful about, how often we do this. There are some people who don't feel satisfied if they wash their hands once. They would want to do it repeatedly. Now, you should understand that will be very traumatizing and very damaging to the skin.
More of an OCD,
So,
I guess. It's a fear.
exactly.
Yes.
The fear of the virus. So yes, so we need to wash our hands definitely when we come indoors from outside. Yes, it should be done the way it's been told to. But for that, when you're in the home spaces, when in the home environment, repeated hand washing should be avoided to the extent possible. Even the type of soap that you use, a solid bar of soap does equally well as a, say, compared to a liquid formulation. But when you look at the liquid soaps, most of them contain antibacterial agents, they contain fragrances, all those unnecessary things which just add on to the burden of the problem.
Right.
So try to be judicious, try to use soaps minimally, but use it properly.
Okay.
That is one thing. Also avoid soaps which contain too much of SLS and those other, those are chemicals. We don't know
Not
what.
okay. A mild
Pardon?
soap is enough. Is that what you're
Yes,
saying?
yes,
Okay.
yes. So that would be one.
Yeah.
And the second thing would be moisturizing. I think that is the main cornerstone for, the whole thing. So moisturize more frequently. So after, say, you wash your hands, pat it dry and then apply a moisturizer. Now, if you ask me what are the moisturizers that we can opt for, I mean, there are multiple. I mean, you can go for something like as simple as oils. The oils that are there in the kitchen. You could, whichever oil you're comfortable cooking, I'm sure you're going to be comfortable applying it on your hands as well. So, be it coconut oil, and coconut oil has been shown to be very, very effective moisturizer. So, definitely the coconut oil or any good vegetable oil, olive oil, almond oil, whatever oil, but a good quality and cold pressed coconut, oils would be a good option. Apart from that, you can go for moisturizers like the regular ones that we get in the market, which are in the creams and lotion forms. So just see that they are not very fragrant. They contain the least amount of chemicals because, like I said, they all add on to the irritant property of the moisturizer. So try to use a good, mildly fragrant moisturizer. or even something like paraffin, a petroleum jelly.
Yes.
That works very well as a barrier cream, so you could use that as well. So here I would like to give one tip for, especially for housewives, going on, they should be using the coconut oil or any oil that they use in the kitchen. Use it frequently on your hands. Keep applying it regularly, as often as you can, and your hands will definitely thank you for that. Okay, so try using your coconut oil or any other edible oil that you use in the kitchen. Use it frequently. And another thing would be, like before we go to sleep, apply a good thick moisturizer on your hand, and probably wear a glove or some socks if you don't find gloves, socks onto your hands, and go to sleep. So that hydration and moisturization will actually help the skin heal better. So that would be another thing.
Yeah.
Apart from that, the other thing I would want to talk about is use of gloves.
Yes.
So gloves, yes, gloves in at home is what I meant.
Yeah.
So when you're using, say, if you feel that there's going to be a prolonged contact with water. Now, generally they say more than
Like by
20
washing
hand.
utensils, we need to wear gloves. Would you
Yes,
recommend
yes.
that? Okay.
Yes. So they say that, more than 20 hand washes in a day,
Mhm.
more than 2 hours of contact with water, all this will make you more prone for an irritant reaction in future.
Right.
So when you feel that you're going to be in such a scenario, try to use gloves, not the hand washing, but the contact with the wet, with water. In
Right.
such scenario, try to wear gloves. And when I say gloves, it is not just a waterproof glove. See that you wear a cotton glove inside,
Okay.
which will absorb the sweat, because generally we tend to sweat whenever we work with
Yes.
gloves, isn't
And it
it?
is so uncomfortable to sweat inside those rubbery gloves.
Yes,
Yeah.
yes, exactly. So that will, again, it is water, and water will damage your skin further.
Right.
So it will slightly defeat the purpose of using a glove.
Right.
So therefore, use a cotton glove inside, which will absorb that sweat, which will absorb the water that is released, and a waterproof glove. You can use, say, a rubber glove or a latex glove, whichever you are comfortable using. So use a waterproof glove on top and go on with your work. So use a glove. That's really important. That's what I meant to say here.
Yeah, that was a
Yeah,
very useful tip to use cotton gloves and then use your regular gloves on top of that. And then you can also, clean them and then reuse also, right?
definitely.
Okay,
Yes.
thank you, Dr. Ashwini, for these very wonderful tips. We'll keep coming back to you for more and more tips which are relevant season-wise or, circumstance-wise. So
Sure.
hope these tips are useful for our viewers to really have hygienic as well as safe and beautiful hands during this COVID season. Wishing safety to everybody and thanking you once again, Dr. Ashwini. Thanks for being with me
Thank you.
today.
Thank you. My pleasure. Thank you.